This is a harder video for me than most. I've been kind of toying with it in my head how to lay this out. And let me explain first, what kind of prompted this. I was talking to John recently, and he was telling me that he was working on a page, I think dedicated to Neal. He told me where to find it, but I actually haven't found that page yet. And it was ironic because he had brought it up to me in a conversation we were having. It was kind of unrelated, but he brought it up to me at the same day that I had found out that someone who I work with, not on smoking related stuff, but in some other areas of my life, that I had dealings with this one person who I only really dealt with him once or twice a year. And the last time that I dealt with him was back, I think it was around April. And he was a smoker, and I know when he was first introduced to me, the person who introduced me says, "Oh, this guy needs your help." And I know what that usually means. Now, again, this wasn't the smoking contact issue, but I knew when someone says they need my help, it was likely it was a smoker. But I don't like to push myself on smokers needing help. If they want help, I want to give it to them, but I don't want to push it. And sure enough, when I met him, his name was Barry. Barry said, "Oh yeah, but boy, I need your help too." He was there to help me on a project, and he says, "Oh, he needs my help too." And that help was, of course, on quitting smoking. But he really wasn't ready to do it at that point. He kind of made that clear, and I gave him, a copy of a DVD with all my videos on it, and I have some book I gave him, that I have. And, I said, when you're ready, you can go there. And like I say, I don't push things like this. I saw him a few more times, and then I always asked him, at some point in the conversation, if whenever actually, I'd wait for him to bring it up, that because he'd bring it up like every time. Oh, but gosh, I should quit smoking. And I said, "Well, have you gone through any material?" No, but he'll do it when he's going to get ready. Well, he calls me up. I think it was sometime in April last year, and tells me that he's quit smoking. It wasn't even that he was quitting now, but he's quit. I asked him if he looked at the material. Oh, not yet, but he was going to. And again, I figured he was off. He had the material. I wasn't going to push it. I really didn't have any real reason to interact with him after that. I wasn't going to, and probably until next year sometime. And I got a letter in the mail. This was just, I guess, 2 evenings ago, basically. And it was from another totally independent person who I never dealt with before, but because of this professional affiliation, was contacting all this man's clients to let all the clients know that he had died of. It said he died of pneumonia. He'd been fighting cancer for several months, so I didn't know many of the details at this point in time. When I called the person, this was yesterday. I was dealing with this. I did call the person, just to find out, more specifics. And it turned out that he had lung cancer and had passed away. And it was a matter of 4 or 5 months. And it was like this person was very, very shocked. Now, I got to point out the person didn't realize who she was talking to when she was talking to me, meaning she didn't realize she was dealing with someone who, ran smoking programs, who dealt with smoking and lung cancer and things like that. And one of the first things she said was, "Oh, they were talking about it at the office," because I said, "Oh, I had actually talked to him," and without again explaining who I was, as far as professionally, I said, "Oh yeah, I talked to him back in March, and I knew he, or April, I knew he was, he had just quit smoking, is what I think, and that he was, getting into exercise and things like that." And she says, "Oh yeah, they were all talking about this at their office, and it's like they were really concerned." And I heard this from her, and again, she didn't realize who she was saying this to. That there was this like concern that his quitting smoking caused his cancer, and this killed him. Well, with this conversation that I was having with John yesterday, it was the same sort of thing. He was concerned about the situation with Neal. Where all of a sudden here we have a person who has quit smoking, doing very well, finds out they have lung cancer, and and ends up passing away from it. And I used to talk about this in clinics a lot, and I had a vague memory that I did this back in March. I made a video addressing this kind of very issue. And it was a video response to someone on the board who wrote, a question that she saw a study that there were people who were spontaneously quitting smoking before they knew they had lung cancer, and it was a question posed on that, like, did maybe she quit smoking just now because she has lung cancer? Not that she had any symptoms or anything, but just because maybe the fact that she just quit, that was the trigger. And I realized it was an issue that we have in a few different places touching this issue. But I think I wanted to put together something here which kind of combines lots of information in this one place. So when this issue does come up, the Neal video was interesting because Neal posted on the board that he was just diagnosed, and the read that I had, the way he was writing it was, he realized that there may not be much hope, and I don't know how much time he thought he had. I felt he thought he had more. I felt like he thought he was going to be on the board a little bit more when he put the post up. And I made a video directly to him about this. And I remember I had trouble with it. For some reason, I couldn't upload long videos, and I had to split it up in two, and it was kind of disrupted on that level. And I knew when I was taking the video, when I was writing his video, that I had to do this kind of a balancing act that I have to do when I talk with people in this situation. And what I mean by this balancing act, if I'm going in, or when I was going in and doing a school program and a prevention program, I would hit hard how lethal this disease was. That, truly the vast majority of people who got this disease, first they got it from smoking, and they got a disease that was going to kill most of them. And I have no problem laying that out because it's an accurate statement, and I'm using it for a prevention measure. But now when I get someone who's been diagnosed with the disease, that same message, while true, it gives a sense of hopelessness. And you know what? I don't want that sense of hopelessness there for a person who has a disease. And the video that I made to Neal very directly addressed that. It was talking about a former clinic participant they had named Charlotte, who again was given this devastating diagnosis and prognosis. She wasn't going to live, and that's basically what the core of Neal's video was about. So I'm not going to repeat that whole story right now. It was a similar kind of situation, though, where it was the issue that I had now with Neal was in a way similar to what I was hearing now from this woman who was dealing with Barry, and in a way I kind of heard it from John a little bit. It's like, it's something we just never really thought about or addressed really clearly. So I decided, and there was one other video that I made back in March of this year. Again, totally unrelated, but somebody had posed a question on the board saying that she saw a study that said that there were people who were spontaneously quitting smoking before they knew they had cancer, and all of a sudden finding out they had lung cancer. And she was concerned again, was she quitting smoking because she, had lung cancer and just didn't know it? So these were all three issues that were kind of related, and I'm going to do something different here. I'm going to attach Neal's full video to this video I'm making right now. Right. I'm also going to attach the answer that I put into this March video, to this March question about, did my quitting smoking cause cancer? So this is going to be a video made up of, two prior videos, with this basically as an introduction. I feel like I need to address what happened. I think Neal thought he had more time, and I was hoping we would have some time to really get clear what Neal wanted done, with this information. And we put the video up, and people were writing to him, and we kind of never heard from Neal and didn't know what happened. And it was several months later when one of our managers somehow discovered that Neal had passed away. And then, John put up the announcement on the board. So the message that I wrote to Neal, or said to Neal at that day, I still think it's an important message in the event, and I'm sorry to say this, but the likely event that this is going to happen again. In clinics, I had this happen a lot. Now, I don't mean that it happens to the majority of people I ran through clinics. That's not the case. But I ran 3,000 people through clinics over a 30-year period. Actually, I ran closer to 5,000 at the hospital. By itself was 3,500, but I did a few more programs that were big before I went, at the one hospital. So over the years, I had encountered this numerous times where I had people who, when I met them, they thought, and this is a key issue here, they thought they were cancer-free and quitting smoking, and then successfully quit, and then years later, and again, usually it's a 1 or 2 or 3 years thing, sometimes a little bit longer, found out they had cancer, and the first assessment by everybody around them, and sometimes themselves, was, oh my gosh, I quit smoking and I got lung cancer. This shouldn't have happened. In most of those cases, again, when I'm talking about a 1 or a 2 or 3 year quitter or a 4-year quitter, the odds are very great. They had cancer the day I met them. It's just the fact. It takes a long time for a person to first develop cancer, for cells to start, and then for enough cells to be present to be able to be detectable. You've got to have a million cells there before an X-ray is going to pick it up. And then it's going to be a lot longer before that little growth that may have been picked up on an early X-ray or some sort of diagnostic technique, it's going to be a lot longer, months or years, before it's large enough to cause symptoms. It's not uncommon for a person to have cancer, again, growing for 4 and 5 and 6 years before they have a symptom, before they know they have it. And then again, when the symptom does present and they find out they have it, the reason they're gone in months, they didn't die in months of getting cancer. They died within years of getting cancer, but they didn't know about it for most of that time period. So is this going to happen again? Yeah, it's likely going to. Again, just with the number of people who we deal with, and over time, this type of thing can happen. So I want to have this video, the message, when this occurs to people that they get diagnosed, I want that hopeful message in there too, that there are people who do survive this disease. Because as I talk about in the case with Charlotte, and then I mentioned a few others, again in the Neal video that's going to follow here, there have been people who were given no hope who did survive, and survived a very long time. So I want that message out for them. But again, at the same time, I do want to keep this message strong and clear that we're fighting for, or people who are in this group, and people who are reading here and watching here, they're fighting for their lives. And I don't ever want to minimize that message in quitting smoking. You are fighting for your very life and existence. And this makes this a very serious matter and a very important matter when you're quitting smoking, to realize, could it be difficult up front? Yeah, it can be sometimes, but the alternative is things happening that, like this, which would happen to Neal, what happened to my acquaintance here, Barry. It cost these people their lives, and I believe in most cases, again, I never talked to Barry about this. I believe from Neal's posting when he did on the board that he has the same sort of sentiment, though, and I suspect Barry probably would have too, that they want people to know this. They want people who are still smoking, who they care about, and even people who they don't know, if they can prevent someone else from facing their similar fate, they want to do that. And we see this often, people contacting John, family members from someone who's passed away or someone who's going, and they want their story told to help other people. And, like I say, these people serve that purpose. So following this video, and again, this is going to be a relatively lengthy video because of, the 3 videos attached here, this one, Neal's video, and the one addressing the issue of getting lung cancer after quitting smoking. It's long, but it's important. And I think for people who are facing this from a family member or friend or themselves, they'll get a lot of information going through these videos. The way to minimize the risk of having to face this kind of personal news, though, in your own future is, again, sticking to that personal commitment to never take another puff. Oh, hi, Neal. John actually just called me to tell me to take a look at the thread. I haven't been on the board for a few days and kind of involved in some other projects here. And actually, I haven't been at the board for a while as far as for responding. I've been having some trouble with my fingers for typing, and things are actually starting to get a little better now. But I've been laying low for a while. But this one was important. I mean, first, I just want to tell you that you're in my thoughts and prayers. I hope things work out well here. I know sounds dismal statistically, and most of the stories that we've shared on the site, the stories of people who didn't make it, who had the same kind of diagnosis and a very poor outcome, and unfortunately, it's the case for lots of people. It's the case for the majority of people who are diagnosed with advanced types of lung cancer. There are exceptions though, and there was one that I thought I had talked about it on the board. It may just be in some post somewhere, but I had a story that I kind of want to relate here, and it relates to you on two fronts. One is never giving up hope. That's one of the fronts. But another one of the areas that it kind of covers is kind of a thank you for coming and sharing your story, because I think when you did it, you did it in the sense that you're not expecting a miraculous cure here, but there's a message you wanted to get out. I had a case where I had a person who was a panelist for me for many years. It was about probably about 4 or 5 years at that point, but a very regular panelist. And I don't remember exact time frames of when all this occurred. I'm thinking it was probably in a clinic that I was doing in 1979 to 1980. I was at a company. In fact, I should be able to track that down. I can track down the company clinic date. But we had a woman who was in this program who I don't want to be locked into exact ages here, but my guess is she was approaching 60 at the time. I think she was nearing retirement age. She was just one of the members of a corporate clinic, and often when I did corporate clinics, I really never saw the people again. But every now and then, some of them would come back in to help with my community clinics, and I had one woman in there whose name was Charlotte, and she quit smoking. She was a very long-term smoker. She was having problems from her smoking. In fact, I remember the one that specifically brought her in was she was having peripheral vascular problems, and the way it was manifesting, she said she was at I think it was a 40th anniversary. I think it was her 40th anniversary party that her and her husband were celebrating, and people were asking them to go onto the dance floor, to have a dance together, and Charlotte's legs started to, cramp up on her, and she could hardly move, and she was saying that, she told her husband to just kind of hold her and sway her a little bit because she could not really work with her leg, and this was from peripheral vascular problems she was having. And when she quit smoking, it was one of the reasons that brought her in, but that improved almost instantly. And this was miraculous to her, and she said she felt better than she did for years when she quit smoking. And she went on to become a panelist who came a lot. She probably came 5 to 10 times a year for that 5-year period. And most of my panelists, I had a few who would come all the time, but most of them came pretty sporadically. She came very regularly and did a whole lot of panels. Well, about 5 years after she quit smoking, I get a call at my office from Charlotte, and you can hear she's very down. She's despondent on the phone. And I asked her, what was wrong, and she said, I don't know how to tell you this, but I'm in the hospital. She called me from the hospital, and she says, I have inoperable lung cancer. She didn't say staging at this point. All she said was inoperable. In fact, that's all I ever heard her say about this particular diagnosis. And her prognosis, they said they only gave her a couple of months, and she was, she just wanted to let me know, we had this long-term relationship at this point. She wanted to share that with me, and she said, and then one of the worst things, this is what she says, one of the worst things, she says, I can't do any more panels. I just can't do panels anymore. I had a clinic coming up in about a week, and she was going to be out, and I said, you could come to this panel, and she said, I can't come to a panel now, and tell people what, that I'm dying of lung cancer here. And I said, are you going back to smoking? And she said, no, no way. She says, I hate smoking. She says, as bad as I feel right now, I still feel better than when I was smoking. And, it was hard to, repeat that. Like, could this be real? But this is what she was saying. She was still very proud of her quit. She had no intention of going back to smoking. But she felt so terrible that she couldn't do panels anymore because she had nothing to share. Anything she said was going to be discouraging. I said, no, you got a very important message to share. I mean, don't do it for me, but if this was something you still want to do, you got an important message here. Not about getting lung cancer. That's not the message. The message you got to share is you don't want to go back to smoking after getting lung cancer. I got to tell you how many people came into clinics with the attitude, man, if I ever found out I had lung cancer, I'm going back to smoking. It's interesting. It was almost a universal kind of sentiment, I would say, in people thinking about quitting smoking to say this. But I had a number of people who got diagnosed with lung cancer. A lot of my regular panelists over the years. When I did clinics for 30-some years. Many of these people ended up with lung cancer or other kind of smoking-induced illnesses, and I can't think of any who relapsed back to smoking when they got the diagnosis. They normally, many times, would come in, near the end because they wanted to still share the message that, they have no intention of going back to smoking. And Charlotte was in that category. I said, this is an important message to say that, even though that the worst has occurred that you could imagine, you still don't want to be a smoker. And she realized she wanted to share it more, and she came to that panel. I had a panel a couple of months later. She came to that panel too and was saying, they only gave her a couple of months at this point, and she doesn't know how much longer she had, but she still wanted to, let people know she still feels better than when she was a smoker, and she just was so proud of herself for smoking and for quitting, and she shared it at that panel. She shared it for, I don't know, another panel after that, another panel after that. And I started to ask her, how are you doing? And she's actually feeling pretty good. Her doctor seems kind of surprised, but she's been doing okay. Charlotte went on to do 18 years of panels with me. And she said it was about a year into it that her doctor was saying this was the miracle. He couldn't explain it. He was actually using her as a case study in a number of different, people he was dealing with. And she went on for 18 years doing panels when she was basically given no hope. And again, I just remember her despondency about, this imminent death and not being able to do the panels. And, neither one came true. 18 years later, I mean, again, this was a number of years back. She actually did finally pass away from cancer, and it was a lung cancer. Now, how it went this long to a remission, basically. I mean, again, I never really heard the official story of what happened. If that final cancer was the exact type of the original, don't know. But I mean, it sounds like she was in a remission of some sort. That's what she's told me all along. Was just nothing was showing, and she was doing well. But when she passed away, I think she was near 80. And again, I don't remember the ages, but she was doing panels all the way through, extremely sharp, very alert. It was very important to her family. There were many illnesses and problems she was dealing with that she was a crucial part of, having to deal with. And she had a lot of extra time that she didn't think she was going to have. I wanted to get that message out on that part that, I know we have to paint a bleak picture when we talk about this disease as a preventative measure to get people to realize they're fighting for their lives when they're quitting smoking. And while it's a bleak picture, and again, it's an accurate picture, but it's not a 100% picture. There are people who beat odds. So, I want to get that message out for your sake, but I also, again, want to thank you for, what I think you very well were doing here is trying to get the other message out of the importance of quitting before it's too late. We've always been saddened when it happens like this, where someone quits thinking they're healthy, but it could take years for cancers to show up. And, sometimes a person quits and then they find out down the line that all of a sudden there's a growth, and they can almost tell by the size of the growth that it was there at the time they quit and they just didn't know it yet. And it very likely is what happened in this case. Again, it's what happens in most cases. People can develop it after they quit, but the odds do start going down lower and lower the longer they go. But those first few years are kind of precarious because you don't know what was there at the time. So again, I hope you have a more positive outcome, and that things, you get a major surprise here, and you can follow a route like Charlotte. There's been a few others too that I had went much longer than they ever predicted. I mean, again, Charlotte went the extreme, and no one I knew had gone, basically an 18-year period with that kind of diagnosis. But again, you're in our thoughts and prayers, and I want to, thank you for sharing. We have the pages of Why Quit of people who have come in basically knowing they were terminal and wanting to share their stories, and that's something you probably want to discuss with John, whether you want, a page kind of set up with that. I'm sure he would accommodate if that's something you want. It's interesting because we really don't try to exploit people in this manner. We want people, if they want to do it, But, we know from Why Quit that when stories like this go up, it reaches a lot of people. It reaches far more than just freedom, which is big in its own right. But, I think a lot of the people that it reaches with Why Quit, besides people wanting to quit, it's kids before they take it up. And, that's one of the important missions that I think Why Quit has for us, is trying to get that message out of the importance of not quitting. And, stories like this can really go on to, help and aid in that mission. And it's very important, I think, to a lot of people when they get into realizing the toll that smoking has taken on them, that it's a message they want to get out to help other people. And if you find yourself feeling in that way, I'm sure John will be able to, help you to, disseminate that message, very far and wide. So, okay, again, I wish you luck, and I'll try to keep an eye on your string on the board a little bit closer. So, all right, and again, you're proving that you can continue to sustain a quit with the most adverse conditions out there, and it's important to recognize for everybody that is possible, even in worst case scenarios, that you can sustain a quit, you can keep your life going, and again, improve your odds of recovery from lots of different problems too, when you do stick to a personal commitment to never take another puff. Oh, hi, Mia. I don't have time to do a detailed written response, but video responses I can sometimes do quicker. This is one of those times. I'm on a little bit of a time crunch here. I haven't seen the study you're talking about, but just by the fact that you said it's a small study, small studies are good for showing that something might be an occurrence, okay? And hopefully that will trigger larger studies, and larger studies can, more or less, either validate that the smaller study was good, or, show that there was other variables in there that you can't identify. I'm going to address this, though, from a different issue. I used to have a chart that I would use in my first day presentations, and it was showing mortality rates for lung cancers, comparing current smokers to ex-smokers, and how the rates would drop over time, and how non-smokers, or how people who quit would eventually get closer and closer to non-smokers, and it was a promising chart, how the rates drop. But there was something troubling about that chart to people. It was showing, and this was from the American Cancer Society at that time who had produced it, that people who had quit for 1 year or less, they were actually dying of lung cancer more than people who were current smokers. And I had people look at that chart and say, oh my God, quitting smoking causes lung cancer. I mean, that's what the chart looks like it was saying. The chart was not saying that. What it was saying was people who had quit for 1 year or less were dying of lung cancer more, but the overall reason that was probably happening was the reason those people quit smoking. A lot of those people quit smoking because they were told they had lung cancer, and all of a sudden they realized, oh my gosh, I better do something before smoking hurts me. And again, that's waiting too late. There's also a chance, though, there's some people who quit before they knew they had lung cancer. And I know this from clinic experience. I had a few people who came in, didn't know that they had cancer per se. They knew they weren't feeling well. They had attributed a lot of the problems they were having to smoking. I mean, they were coughing. They had, chest pains. They had all these things. They just weren't diagnosed yet. And then all of a sudden, they quit smoking and they do well, but then a number of months later, sometimes it was a matter of a year or two later, all of a sudden, they go in for a routine x-ray and there was a cancer there. Now, there was a very good chance that these people had cancer in them the day they quit smoking, and they didn't know it. And yet, in a way, their body knew something was going on here, and they made a good decision. They quit smoking. I mean, again, they listened to a signal, although they were doing it, and again, with the hope of preventing an illness that, in a sense, had likely started already. And again, maybe some of these cases they started up, even after they quit. Although when you talk about people who are off for just, a year or two, cancer is usually growing a relatively long time before it's going to show up on an x-ray. And people who are quit for a year or two and all of a sudden if a cancer showed up, there's a pretty good chance that cancer had already, started at the time of their quit. But again, I would say that some of these people did have cancer, did not know it, and yet they, in a way, knew something was up. I've seen this with pregnant women who didn't know they were pregnant, who all of a sudden just start to lose their desire for a cigarette. They don't want it anymore. And then they find out, usually, again, within days of that quit, that they were pregnant. And they didn't make the connection, but it may very well have been what triggered it. So what I would say in this case, as far as you personally, is the reason you quit smoking 2 months ago because you had cancer? I don't know. I doubt it. I don't think the majority of people that we encounter, in a clinic or on a site are there because, their body is sending a signal that they have cancer that they don't know about. I suspect people in this many times are researching for a long time before they even quit, and things change in that interim period. But whether you have cancer or not, no one can answer that. That's something that, if you have the concern, go to your doctor. Tell them that you have the concern. It's the type of thing doctors are often, when they're dealing with someone who is an active smoker, they're sometimes a little bit hard to deal with the doctor because they feel like they know what you need to do. You need to quit smoking. That's the one thing that they know is going to reduce your risk the most. And people aren't going to listen sometimes. But, hold on, I got to get the dog to quiet down. Oh, quiet. Okay, but once you quit smoking, they're often much more receptive because they realize you have taken an important step here. And they want to often do what they can do to help you sustain that. And if you have a concern of something like this, if they feel that, because of your pack years, maybe because of other symptoms or stuff, that, that it's warranted, they can look. They can do x-rays. They can do more extensive if they feel that there's something that needs to be done. Would I do it just because of this study? No, that's not what I'm saying. Not to do it because of one study showing, that this is sometimes happening to people who quit smoking. But just, it doesn't hurt to get checked out if you have that concern. Okay, that's all I can say on that. All right, I like I say, I'm kind of pressed for time here, but I just wanted to get a quick answer to you. Again, the most important thing that you can do and anyone can do to reduce the risk of getting cancer is to quit smoking. There's also a few articles that we have that illustrate the importance that even when people do have cancer, when they quit smoking, they have a much better chance of beating those cancers. So if it would turn out to be that worst case scenario that, oh my gosh, cancer was there, quitting smoking still gives that individual an edge as far as being able to tolerate the treatments that would be necessary and to survive that disease. So I'll try to attach those links in there too. But again, that's not saying you have it. There's no way anyone online can tell you that. That's something that if you have that concern though, it's best to get checked out. Okay, I hope that answers your question, and I suspect John will look in and see if there's any other studies. John's much better at finding studies than I am lately. And basically that's the way, again, to reduce your risk of developing a future cancer. If hopefully there isn't one here already, the way to reduce that risk is what you've done already, and that's making and now sticking to your personal commitment to never take another puff.